Hi, I'm Dr. Harris at California Hernia Specialists. One of the most important questions that we answer for our patients at consultations is about complications after surgery. Obviously, it's a very important topic and something that we want to inform you about and something that we want to discuss with you at the time of your consultation. So I thought I would put together this short video on complications after, in particular, hernia surgery. The first complication that we can see is infection with any surgery. Anytime you cut the skin open and the skin has to heal, there's always a small chance of infection. The incidence of infection after a normal hernia surgery, which I would describe as a non-recurrent, a non-incisional hernia where the bowel isn't injured, which is 99.99% of our hernias, the infection rate is less than 0.1%. So any sort of life-threatening or serious infection is less than 1 in 1,000. There are some times in our practice, and I would say every year maybe I see about 0.5% of my patients, or even maybe 1% of my patients that come back with what we call a cellulitis, which is just a little bit of redness and irritation around the skin where the incision is, which can be a little painful. It can be sensitive to touch, again red and inflamed, and usually that happens about 1 to 2 weeks after surgery. And we treat that with oral antibiotics, and again, of those cellulitis patients, all of them get better and all of that redness goes away, usually even within a couple of days. Knock on wood, in the past 4 years we haven't had a serious infection of mesh. So I would guess that we've done thousands of hernia surgeries. We probably do again about 300 to 500 a year. And so if over the past 4 years we've done anywhere from, let's say, about 1,500 to 2,000 hernia surgeries, we had one infected mesh that occurred 4 years ago. So pretty good track record, and certainly we think that's a very small complication. Obviously if it happens, it's a big complication, but there's a small chance of that. One of the other, and I don't know if I would describe it as a complication, but certainly one of the other things that we discuss with our patients is that the hernia can come back. I'm not perfect. No surgeon is perfect. The body doesn't heal perfectly in every patient, so there's always a small chance that a hernia can come back after we've fixed it. I don't know that I'd specifically call it a complication because it is something that we know about and we discuss with patients, and that's about 1 to 2%. So about 1 to 2% of patients can have their hernia come back. So at the end of any given year, if we've done 500, there can be a couple of patients that come back sometimes a year or two later and say, Dr. Harris, my hernia came back. And that can happen, and that happens with every surgeon. So if you're a surgeon, if you had a recurrent hernia, again, I don't think it's any fault of the surgeon. So one of the other complications that we discuss with patients, and this is extremely rare these days, is chronic pain. We did another video on chronic pain to talk a little bit about that specifically. The incidence of that is probably around anywhere from 1 to 3% of patients have chronic pain after hernia surgery. The incidence isn't increased with mesh. They've actually shown that chronic pain can be increased without mesh because of all of the tension that you have to put on the nerves and muscles within the groin after surgery. So a small risk of having chronic pain. There is a risk, depending on the size of the hernia. There can be fluid collections that can form after surgery. Usually we see this in large scrotal hernias where gentlemen have let it go all the way down into the testicle. It may be the size of, and as you've seen on maybe some of our pictures on our website, the size of a football, the size of a volleyball, or sometimes even smaller where it may be the size of a softball. When we take that hernia out of the groin and take it off of the testicle and put the intestines back where they're supposed to be, there's obviously a large empty space where that softball or where that hernia used to reside. And sometimes in some patients that can fill up with fluid and cause what we call a seroma, which is a fluid collection. A majority of the time those go away on their own and we don't have to treat them. In rare cases with, again, usually large groin hernias, we will see patients with hematomas or seromas that we need to go back in and drain and remove that fluid. Again, that's rare. That probably happens maybe once a year or every other year. So again, much less than 1% of the time. Hematomas is something else that we see. Patients can certainly have bleeding in the groin after surgery because of the fact of a large hernia, and we're peeling that hernia off of the arteries and the veins. Sometimes, even though the bleeding has stopped in the surgery, during the surgery, afterwards, a day or two afterwards, a little bit of bleeding can start, and patients can form hematomas. Again, that's very rare. It may happen once a year. Most of those will resolve on their own without surgery. Rarely, again, maybe every other year, we would have to go in and remove that hematoma from the patient. One of the other complications, and this usually only happens with patients with hematomas and seromas that we have to reoperate on, is the loss of a testicle. Obviously, as a man myself, that's a concerning thing and something we obviously avoid. The incidence of that is much less than 0.1%. And that has happened in one of my patients, actually, who did have a lot of bleeding and had an enormous hernia, and had bleeding afterwards. And when we went back to drain the bleeding, we had to take out the testicle at the same time. So it's happened to me. It likely happens to a lot of high volume hernia surgeons because of the risk of having a hematoma. But in a normal, typical hernia, and we would never have patients lose a testicle. So certainly that should be extremely rare and not anything that most patients have to worry about. So again, a little bit of infection, cellulitis. Some patients that have a real true mesh infection, which is extremely rare, chronic pain, fluid collections, hematomas, and loss of a testicle are the side effects or the complications that we would see from most of the surgeries we perform. Obviously, a whole separate set of complications would be, complications from an actual surgery, heart attacks, strokes, things like that. Again, knock on wood, we haven't seen that in years, and so it's extremely rare, and for most healthy patients, it's nothing to worry about. So, in any case, I hope that helps you feel a little more comfortable about your hernia surgery. We're certainly here to answer any specific questions you have. We'd be happy to meet with you. Give our office a call, and we look forward to taking care of you if you need it. Thanks.